now then, are you ready for your massage?
Massage?
Yeah.
Yes, where do I lay?
This, right back there. I don't think we made it too wet.
That's what you went through.
That's what he was volunteering for, yes. I hear you. Yes, and thank you. Notice somebody, she knew that I needed to put that back. Thank you very much. Nice to have helpers when you got so much to do. Okay, so I'm rushing because I've been told, when do we get out of here? 5:30. Okay, so I thought you might like to at least learn a little bit about massage. Okay, and is there anything I haven't demonstrated yet in the book? Okay, well, I just want to let you know there are some endangerment sites you want to be careful of. First of all, what's this one for? You don't want to go anywhere, remember that this is a choking, you don't want to choke them, right? Right. So you can work on the sides, you can work on the back. The other thing is, I'm trained in what I do, okay, but I can teach you certain things you can do for family and maybe friends who are having a hard time. I get paid for what I do. You cannot be unless you're licensed, okay? But it doesn't mean that you can't bring relief to a family member or to a friend, and you can do that if you want to, okay? So I'm going to try to teach you a little bit to do. Maybe it's your mother, maybe it's your sister. She fell down and she's fine, but she just continually has this pain, and it's probably muscle involvement. Okay, so I want to teach you first, the things that you don't do. You don't do in the front here. You don't basically worry, you don't get too close to these. Why? This is where, remember how phlebotomist comes and they stick things right in there? That's because that's close to the surface, right? So both elbows are the same. The back of the knees are the same. You want to be careful not to be hitting over the kidneys. And also, you notice your hip bones. Your hip bones are kind of close to the surface. And so you want to be careful not to suddenly go down and come up against its hip bone with a lot of force. Remember that that's close to the surface and you can bruise a bone. All right? So let's see. The groin area, okay, that's where think circulation close to the surface, stay away from, right? And the other thing, bony prominences, it's okay to touch them, it's okay to massage a little bit, not with force. You don't want to bruise those bony prominences, okay? And it hurts. Have you ever had somebody go on your olecranon? Yeah, your olecranon is here, this is what? Acromion, yes. That's what I was trying to remember. Your olecranon is down here, right? Your chromium process is here. So feel that bony process on you. There's not a whole lot of skin there. And if you push very hard, push harder and harder and harder, that gets painful. So somebody who's not you pushing on that could hurt you. So just realize it. Any bony prominence you want to be careful of. And that's including these wings back here, right? Call them our scapular wings. You can do massage, but you don't want to go hard on the bony prominences. Okay, so any other endangerment places? Of course, you're going to be careful of the temples. You're going to be careful. The head is good, but you're not, you can't hit it, of course. So, but your temples are very, very, you have to be very sensitive, that's right. And you want to be careful of the nose. Hopefully you don't want to hurt somebody when they're down. So that's it. So we're just going to do a back massage, okay? And and I should have brought my cream. I know I did. It's around here somewhere. Slippery. So if you'd like to pass this around, you have to order this from Biotone. Just go ahead and pass it around. Everybody can read the name. That's what I'm using, all right? It happens to be one of many massage therapists' favorite cream, and I'm one of those. They also have hypoallergenic. This pretty much is hypoallergenic, but there's one that's even more so. And the one thing with hair, you want to use a lot of cream so you don't pull the hair as you're massaging. All right, now we have it pretty good here. So I'm going to go down, and one thing, you go on either side of the spine. You don't go down the spine, but on either side of the spine, right? And then you go around. This is the beginning stroke. We call it the butterfly. You can see, you can go down either side of the spine. So you can do this with your fingers too, or you can go this way and keep your thumbs up. So, and again, you're putting this lotion on, and this is a butterfly stroke. And you notice you get all that in the middle. And it's just a nice application of the lotions. This is a cream. The one thing I have learned that you cannot use hand lotion. It will absorb into the tissues too quickly. And you can use olive oil. You can use coconut oil. You can use corn oil. I just don't recommend it because it's not the best. But if that's all you've got, better than nothing, right? All right. So this long stroke, it's called effleurage. These are French terms, effleurage. Yes, it was. We all took massage and nursing, and we gave a massage to our patients usually every evening if they wanted one. All right. And then, again, this is an effleurage stroke up over the shoulders. And you notice that basically, then I can come over here. But if I want to work on this other shoulder, I'll walk around. Keep your hands on your person. And then do this side over here. You can come up the neck with your thumbs. And the neck is fine. The back of the neck is fine, except how's your neck? Because he's had surgery on his neck. Is that, yeah, is this okay with this pressure?
Perfect, yes.
Okay. All right. Yeah, and I'm doing my best not to hurt his neck, but I am massaging it. I can do that gently, and it feels good. If I I could possibly hurt him, and I don't want to do that. So that's how I'm checking, is this okay? All right. So then the other thing is, I'll come over here. Another stroke. I'm sorry, that was me, wasn't it? Okay, another stroke. And you don't have to know all these, but I come in here, and right over the iliac crest of the hip, I bring my elbow. You don't have to learn to use your elbow, but we do use elbows. And they come right alongside the spine. Now, the thing that I learned, put your fingers right there so it doesn't go on the spine. Put your finger and put your elbow in that C. All right, and then you put your fingers on the spine with no pressure, and you put your elbow, you can put a little more pressure, and I can go deep if I want to on that elbow. It just depends on how much I'm supporting my own body or letting him support it. All right. Okay, so I'm going to go a little deeper. How's that feeling? All right. And you notice I'm keeping on with my eye, but with people who are not practiced at this, I would keep your fingers here. But I keep my eye where I want to go, and I can push a little deeper. Okay, you can do that 3 times. In massage, 3 strokes is good. 1 is not enough. 2 is give me more. 3 is It's probably, I can do it with a little more of that, but at least 3 at least feels more complete. All right. And, all right, so I'm just coming up here to the shoulder and I'm massaging, and you can put both hands on one shoulder and then kind of pinch that tissue up there and just hold on to it. Just hold on to it, and eventually it's going to roll out from under your fingers and you can't hold on to it anymore. There you go. See? All right, so now then, petrissage. So the F long, gentle strokes are F large. Petrissage are short, kneading, like you're kneading a bunch of bread, right? Kneading, kneading, kneading. And you can consider this combination of effleurage and petrissage because it is a kneading motion, but it's a long, gentle. All right. The lumbar stretch, yeah. Mm-hmm. Oh, then you come over, because I want him to feel totally done and not just lopsided. We'll come over here and do this other side. And now, I don't know if you can see, but again, I'm going to put a little lotion here, and I'm going to go in above the iliac crest, which is the top of your hip, which is a danger spot, so you want to go above it, not on it. And again, beside the spinal cord, and if you have questions, put it in that elbow, in that C, and curve your fingers, and then just go up. And stay off of the bony. You know, you don't want to go up the vertebrae. That clunk, 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 clunk. You can imagine each time you do that, that hurts. And there's a number of those. So we go right next to it. Okay, then there's lots of different kinds of petrissage. There's the feathering, like it looks like a feather. There's ironing, which is a thumb deeper, and you'll see pushing a little deeper. It's called ironing. And a lot of people like that movement. And the feathering is kind of getting a little lighter and helping it relax a little bit. So those are just a few. And tetrissage, or tapotement, is when you do the clapping. Okay, and a lot of times we do that up around the shoulders, right here. Okay, I'm not going to really do it hard. I'm just going to show you as you can practice this on each other. Get your hands together, fingers apart, brush them back, and try doing their shoulders. And do not do the spine, but you can see where that wing is and the spine, so you can do that little area right there. So just be careful not to hit the bones. Right? All right, so when he sits up, maybe I'll do some of that. All right, guys always like to have their heads massaged. You notice that thumb?
If there's anything you may have missed you'd like her to do over?
Well, the one thing, he's on his tummy, and remember, you can do both sides. So you just basically, you're doing their arms, but when I do the face, the first time I had a guy that I was, not necessarily my first massage, but he says, please do my earlobes. do the ears, and he says, my favorite place, do the ears, and you got to go inside and do them, So guys like that, most guys do. And it's relaxing, okay? And it's just an ear. And you're not going in the eardrum, you're just going in the thing that's sticking out here, all right? All right, so take a deep breath, Rick. Nice, slow, Rick. All right, so I'm just going to teach, back massage If I should probably teach you how to drape. If you're going to be doing your family on a thing like this, all right, and they don't have their pants on because you're going to work on a leg, all right? And I always take my top layer, which is a blanket, over. Then I will bring my inner layer and I will put it between the legs. And then, all right, Rick, with your permission, I'm going to lift up on here. Okay, and then he can help me too. But you just put this down there. And of course, the pants usually are not here, but then you have this leg that you can massage on. And if they fell, if they're bruised, you know, it's you can just massage, and you keep your fingers on the outside, right? Keep the fingers on the outside. But, and you work on their feet, that's comfortable. And, okay. He's got his, you can just come and do the foot very, I get down here, you can sit down or squat, and you do it like each little half an inch of the heel. The heel gets a lot of pounding. 3 times, 1, 2, 3, 1, 2, 3, 1, move it, 1, 2, 3, 1, 2, 3, 1, 2, 3. Come down, you can change hands, give your hand a break, do the outside, 3, come in the middle, and then you can put both hands together in that low arch of your foot and just massage it really good. Then come down here to the ball of your foot, and then again, each toe, each ball joint, 3 times. 3 times. And then you pull on the toes. Massage them, pull them a little bit. Massage them, pull them a little bit. It feels amazingly good, you know. And even though I didn't have, you know, the leg, I know that he felt that. And it's probably felt very good. All right. So the arms, you can do the same way. The hands, the wrists, you ready? Okay, for this, I'm going to need you to turn over then. Okay, so if they're going to turn over, all right, I'm going to take this out, Rick, and get ready to, all right, now, you might say this is my son. He had a sports accident or something. Okay, scoot down on the table. And then if you go ahead and turn over now, face up. Can you turn over? Can you turn over?
Oh,
Now I'm holding this in place with my body right up against the side here, okay? See what happened? I held that, and then you can come as he's turning. You got some things tangled up. You can just put this, lift up your knees, and I'll put this back under there. All right, there you go. Now, the one thing, I might not, okay, I may not have demonstrated this real well, but I want you to know body mechanics, and that's you bend, you can go either way, but you bend with your knees, okay? All right, I'll take an arm, and we will, so.
you have something to put on my neck. that
Oh,
doesn't
yeah,
look
yeah,
like
yeah, yeah, you're right, I'm sorry. I don't know what happened to all these pillows. Yes, he's had a bad neck. Okay, and I've got that, and how about something a little more underneath? Is
This is perfect.
that perfect? Okay.
Absolutely.
All right, so he's a hard-working man, and he's got strong hands, and you do every finger 3 times, right? 3 times. 1, 2, 3. 1, 2, 3. At least 3 times. All right, and then I bring it up. I like to go into the palm of the hand. All right. right, and deep into that thumb and the palm of the hand, that big muscle there. You can go in between the index and the thumb, right in there. A lot of people grip all the time. That's a place that's usually pretty tight. All right, one thing, I'm bending over, but I kind of like to have a good base of support. And you're always moving, always moving. And I'm coming out here. The first thing I do, get here and go down, because I'm getting a little farther away from where my other foot was, and I can just move. All right. Okay. That's just 3 times is usually the general recommendation. Now, as he has injured himself, he says, "Mom, my shoulder," or something. All right. And he does have an injury here to his old shoulder. So I'm going to come up here and check out. You notice again, I've got a wide base of support, bending my knee, leaning against this table a little bit. And I'm checking out these deltoid muscles, anterior, posterior, medial deltoid. See, and one of the things that you're going to do is, if you feel any tightness, any pain, work on it a little bit more, okay? And then be sure and rub it out afterwards. Anyway, that is basically arms, leg, back, and yes.
After all that hot and cold treatment on his back, he didn't find
Then, did it hurt any part in your back?
No, you did a fine job.
Okay, all right. Well, the one thing I've been a little worried about, the fact that I went ahead and did a massage, and I had just done that treatment. So I've been trying to keep him covered, because other than the fact that I did a massage on his back. And did you feel too cold when I did that?
No, ma'am.
Okay. Anyway, so basically, oh, we didn't do your face, did we? I did the back of your head. Okay. So the thing, a lot of, yeah. All right, so wide base of support. Be sure and move your knees. And, all right, just come up here and start here and right over the eyebrows. You go then on the eyebrows. Don't go any farther than that. There are some pressure points right here. Okay. You can, a lot of times people get headaches, and you can just gently massage those, or they can do that themselves if they know where it is. But you just start there. And you wouldn't know it, but your skull actually has several little pinpoint holes in it. All right, so then we're going to one, two, three, 1, 2, 3. Come down, 1, 2, 3, and then he's got some muscles down here that are pretty tight. Are they tender?
A little,
You grit your teeth at night?
probably. If they'll get more massaging, exactly.
All right. Anyway, so the wonderful thing is that there's therapeutic massages for everything. Even I've had to help somebody, a girl who was hit with a basketball, playing basketball in college, and came up and hit her right in the face, and she'd been having headaches, and she came to me, and we worked on her head. We worked on different points in and outside her mouth. But yeah, I wore gloves and massaged those muscles. But you have to know what you're doing with all that, okay? But these gentle movements that you avoid prominent bones, you avoid the dangerment sites. You're not going to do the carotids, you're not going to do in here, right? Okay? And your elbows and places that you don't want to be, I was going to, doing the deportment. You don't want to do that over the kidneys, right? There's things that you don't do over the kidneys. All right, so anyway, there you go.
Yes,
You want me to do the other arm?
Whatever you want, I'm just here for them.
Well, don't want to leave him lopsided, right? So anyway, is there anything else that you'd like to know in the hydrotherapy book? Seems like there's a few. Yes. 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 Is that okay if I demonstrate the intestinal area?
I'm yours.
Okay. Well, the thing is, it's great. You can actually do that over the sheet. So anyway, we're getting through. So the one thing about the abdominal area, some people don't like it touched. So I don't do it for everybody, but I will check with them if they need to have something like, that done. And I have been able to find ahead of time some cancerous tumors that I told my patient, you need to probably go see a doctor, and sooner than later. This is what I think it might be. I can't tell you for sure, but he'll be able to tell you for sure. And she went to see the doctor, it really was, and we were able to get her in treatment quickly, and she's doing fine today. But there's something else as a massage therapist, we're kind of trained to look at all the moles and the skin lesions and recommend whether they go to see a dermatologist or not. Might need to see a dermatologist about that. So we study. It also helps that I'm a nurse and studied that ahead of time too. But all right, so he's not totally lopsided there. There you go.
Wonderful, bless your heart.
You're welcome.
Thank you for
And
all the questions.
let me move this out for you. And then if you want to sit there for just a minute and then sit up, and you can put this on if you'd like, but I just thought I would just demonstrate any part that is a lot of muscle, I can come down here and do this here. Again, you don't want to go over the bones. You can come down here between the spine and the scapula. Coming over here. I'm sorry, is that hurting? Did I hit? Is that hurting?
Oh, no.
Okay. Okay. All right. And you have to practice that. So practice hitting a pillow or something. All right. And if you want to gather around, you can, or I'll try to show you from there. But, because, yeah. Anyway, you can come over and don't want to get on his ribs, okay? You want to get under the ribs, so I'm feeling where they are, and we're going to start over here. And what you do, you follow how does your intestinal tract go. The big one, the little one goes this way and then does all this curving around, but then it goes up and around. So you can actually come in here, put your hands here, and go in circles, just in little circles, and come this way. The other thing you can do, don't forget, I forgot to tell you about vibration, okay? And then you can vibrate. And it's just just vibrate. Circles, and vibrate. Circles, 3, and vibrate. And vibrate. And vibrate, and vibrate. And then remember that your large intestine comes this way. So you can, I sometimes will feel for the liver. Is the liver in a good place? Do I feel the liver? If I feel the liver, that liver is enlarged. You shouldn't feel your liver right? Can you hear me? All right, so the other thing, the spleen is over here on the other side. The liver's on one side, the spleen and the pancreas is on the other. The other thing is, if you have pain going across this way and shooting around the back, it could very well be pancreatic pain. So get it looked at, right? All right, so then we're going to come this way and go 3 times. 1, 2, 3. 1, 2, 3. You can be examining for the spleen at the same time. Again, if you feel it protruding beyond the ribs, it might be enlarged and inflamed. And then you can just, when you do the stomach, you kind of do half of a sun and half a moon, and then you come and do the other. So it's like a sun, they call it sun and moon, but that's just because you do a full round, and then with the other hand, you're coming and doing half. So that should help the stomach.
I think breakfast is on the move.
All right, there you go. And, you know, you can do that to yourself if you need to. You can do that for someone else. Well, I wanted to tell you about the importance of vitamin D and sunbathing, something that I meant to bring a little flyer about sunbathing. We talked about it. I just want you to know that getting the vitamin D from the sun is going to help you utilize all the rest of the vitamins that you get in your food. But without vitamin D, you can't utilize your vitamins very well. 2, above the 45th parallel, which we are, doesn't really matter how much time you spend out of the sun, even in the summertime. They tell me you could be naked out there all day and not get enough. So we need to supplement our vitamin Ds. The one thing, if you're supplementing vitamin D, you need to have vitamin K2 with it, because the vitamin D will help to utilize your heart muscle minerals, potassium, magnesium, calcium, and zinc and selenium, okay? But the thing is, and selenium is for all muscles, it's not just heart, but it's for all muscles. So you need vitamin D to utilize those to their best ability. But you have to have K2, which our body, for some reason, doesn't make, from what I have studied. Do you have any different information about that? Okay. Take D3 and K2 together. And the reason why is if you do not take the K2, that any excess calcium and stuff like that can adhere to your arterial walls when you want them to go back to your bones. So the K2 will direct it back to the bones where it needs to go. Because if your body, in our system, you know, if anything is leached out, it comes out of our bones. Well, maybe you could put it back in if you got K2. All right. And it's going to have to, from what I understand, you really have to get something else besides what your body is making, or eat something that has the K2 in it. And I have to do a little more study about that. The thing that I know that Medicare and won't pay for the vitamin D, usually. So you might have to invest in a little bit of something to make sure that your vitamin D is all right. But most of us are low on vitamin D, not high, unless you're taking supplements too much, and high degree supplements. A cold compress over the forehead like we did, and you can put it over the heart when the heart gets too overly stimulated. There's the other part that I wanted to show you, which is heating compresses, 68 heating compresses. Okay, I want you to imagine that this is a cold, wet t-shirt. All right? And then I think this one will fit you. And then we're going to make Remember, did your mother ever put a cold sock around your neck and then something else? Okay, see if you can get that on over that, Rick. All right, the other thing, so my grandfather used to get walking pneumonia. Has everybody learned about, I don't know what the difference between walking pneumonia and regular pneumonia is, but so you notice how, okay, I told you that his t-shirt was wet and cold. This is a wool sweater, and you notice I asked him to put it on. I knew it was going to be a little tight on him, but I wanted it tight because the cold one underneath, the wool is going to wick that cold away from him, just like the warming socks. It'll draw him out. He's sick, and I'm going to put this cold one on him. It's cold and icy. And you just pin it there. We just pin it there. And pretend this is wool. It's fleece. That's what the other word I was thinking of, fleece. All right, so then this will be dry. And again, it's wool, so it's going to wick it away. You put this over and you pin it on. All right, you pin it on. And then you can pin it so that it stays right here. And he can go to bed with that cold thing on his neck, cold thing on his chest, and this wool, and go to bed, and it's going to wick all that congestion, sore throat, everything else away. And this is called a heating compress, because the same thing, that's what the warming socks were, is a heating compress. When you really try them out, they will be wet, and you want to get them pretty dry, you know, wring them out pretty good. You don't want them soppy wet. But then when you wake up in the morning, they are dry, your feet are warm, and it will draw the congestion away. And this actually draws the congestion out in a way. It takes the soreness out of a sore throat, takes congestion. If you're coughing, he will stop coughing during the night, getting a good night's sleep. All right? Now, so you've learned about the neck one, the chest one, you've learned about the warming socks, you can actually, where's that book? You can actually do this. Now, I showed you the easy way with the sweaters, and I tell you, these are wool sweaters. They're kind of expensive, don't you think? Have you looked at them lately? I got these for a few dollars at a thrift store. So you can get these beautiful sweaters, and you got a cotton t-shirt, make sure it's a cotton t-shirt, and then that is a compress. Now, if you don't have a sweater, maybe it's a child and you don't have the right size sweater, you can use wool wraps. And somewhere around here, I have some wool wraps, but we'll just pretend here. So you can actually wrap there. If you have some wool, you can cut it in lengths, and that's what my wool wraps are, cut already previously. But you can actually use this to cover if you cut a section and make it long, you can actually wrap it around and around and pin it in place. But you put the wet shirt or the wet wrap on first, and then you make this long. You can, if you're good with a sewing machine, you can make them long individual, or just mine, which I don't want to do with this one, I cut in strips and just wrap it around them and pin it in place. Natural. You can use modal, bamboo. You can use, if you are allergic to wool, well, are you allergic to it when it touches your skin? I would get it's called merino wool, lamb's wool, very soft, and it's not adult wool. So you might try that. This one is actually, what's that? This one is silk and cashmere and wool combination. Because silk is a natural fiber, cashmere and wool. You might try feeling this. It's really nice. So the other thing, though, I have been told if you are allergic to it, that you could put that dry wicking, it's polyester, but it's that dry stuff that they use in the sports world to wick it away when you're skiing and stuff, possibly that. But again, we trying not to use polyester and stuff, but we have to consider if you're allergic to these things. But the problem is cotton does not warm, and the polyester would, and you have to have something that warms. That's the reason why we recommend wool, is because I tell you, you put that on and you're warm pretty in it, and it will keep you warm. You might try one of these wool blends that has, this is silk with it and cashmere. You might be able to do something like that. And again, you're putting t-shirts and other stuff next to your skin, and then this over it just for the warmth to help hold it and wick it away. So whatever does that wicking away for you, if you can't wear anything at all. But I know what you mean. I didn't like wool. It used to be itchy, but I have found that these are fine. You know, we have to consider that you're allergic, okay? With, like, my sister-in-law is allergic to garlic. Leave the garlic out, because guess what? From that drink that we had, turmeric is anti-cancer, antibacterial, antiviral, it will kill a lot of things. So does ginger. It's antiviral, antibacterial. So is the onion. So is the garlic. So is the honey, the natural honey with 84 vitamins in it. If it's local natural, that's the best raw. That's the best kind of honey to use. Well, look at, if you got 4 things in there, if you have to get rid of one because you're allergic to it, you got everything else still there, right? So it's just, what do you do to overcome these allergies that we have in our lives in this generation? The vitamin cure for allergies. And this is, I haven't had a chance to read it yet, but I bought it because I know I'm getting more sensitive to things. How many are getting more sensitive just even to the air we breathe, And you heard me last night, I had that little coughing, and I needed to get some water. I was low. Thankfully, it's been okay today. But it hit me earlier at her house, right? We were talking about why, and all of a sudden, well, I just drank more water, took a soothing lozenge, and it went away. But the fans came on for the wood stove, and maybe we figured it's blowing a little bit of dust in the air. So it just happens, and we are becoming more prone because of different things that have been put in our air to breathe, and things that are in our foods. And I do have a book on there about toxins. And I will tell you another story quickly. I know we got to go, but because of my coughing, and I got a little cold here recently, and I do use a lozenge once in a while to try to keep it under control. Well, I went to Costco and got these research lozenges. They're good, sugar-free. I never thought of it. Anyway, I was using those, and I noticed I'm a singer. I have sung for years. All of a sudden, I can't sing anymore. I can't hit those high notes. And then what? A couple years after I started using that, I looked at the ingredients. Aspartame. I didn't think sugar-free, maybe aspartame would be in it. I didn't even think of that, And how long did it take me to look at the ingredients on something that, I was so sure Reese's herbal things, were good, and I just grabbed the Costco stuff. And sure enough, it's aspartame. I stopped using the aspartame, and I'm beginning to sing again. Just to let you know that, it didn't all go away, because I think some of it could have been from the colds that I got as well. When you get more colds and more colds, I'm not a young thing anymore. So we need to take care of ourselves the best way we can. If you're allergic to things, maybe you need to find out something about vitamin therapy, because now, I mentioned last night that back in 1950, our oranges hardly had any vitamin C in them. Yet we eat oranges for vitamin C. This 74 years later, almost 75, right? And our food and our soils that are being farmed, the Bible says, let your soil rest every 7 years. Forgive me if you don't believe this, but the Bible says, let your fields be fallow. Don't even, let it go and let it recover. Then you can use it again. And then 2, we need to rotate our crops and every 7 years, let that one part be fallow for a while and let it recover. And when it does, all those nematodes and bacteria in the ground are making good soil again. How many have questions about Epsom salts? There is a thing in here, couple pages that you can read about how they were made. Remember that Epsom salts can be a laxative. If you need, it's a magnesium sulfate. Okay, so you can drink a little bit in some water and it will help with your magnesium. It also will be a laxative, so be careful of that. Many years ago, Epsom salt was the most popular drug in England, although people who used it did not know exactly why it was so valuable. They knew nothing of its antiseptic and antidotal qualities. But they did understand that in some way it was good for their health, and they promoted longevity. They found by experience that not only did it keep away sclerosis, kidney disease, and rheumatism, but that it also was very useful in correcting any tendency to put on too much weight. But did you notice that it helps with sclerosis, kidney disease, and rheumatism? A favorite form of administration was that of an old black drop, whatever in that, taken on rising. So, which consisted of Epsom salts in combination with senna, again a laxative, licorice, and certain flavoring agents. But one we don't ever hear of it now, right? Another favorite formula was known as MFS, which is Mistura Ferricelina, which is a stock prescription in regular use in most hospitals. It combines Epsom salts with diluted sulfuric acid and sulfate of iron in stable small medicinal doses combined with peppermint water. It was considered to be an excellent liver cleanser and was almost a specific remedy for piles. Piles, as I remember, is hemorrhoids. Okay. Today, Epsom salt is practically unknown in Orthodox medical circles. Although it is extensively used among exponents of nature's cure, it will be, as later explained, Epsom salt is now made from a rock substance called dolomite, which is found abundantly and derives its name from the mountainous district in the South Tyrolean Alps called Dolomites. When examined by the chemists, this dolomite rock is found to belong to a very large group of substances known as salts, in which an alkaline base is combined with an acid radical to form a neutral substance called salt. It consists of 2 metals, calcium and magnesium, combined with 2 non-metallic elements, carbon and oxygen, and takes the form of a neutral double salt known as carbonate of calcium and magnesium. So now Epsom salt is also a salt, but instead of being made of magnesium, oxygen, and carbon, as in the case of the carbonate salt, its constituents are magnesium, oxygen, and sulfur, chemically known as magnesium sulfate. How to treat pandemics. As a nurse, I was appalled by the fact that they said, wait until you can't breathe to come into the hospital. Okay, that doesn't make sense to any medical person, all right? You treat it immediately. Remember when I told you what I did? I came home, put charcoal on my chest and my neck, drank a lot of water, and went to bed. Then the next day I rested, and I felt so good because it was a nice vacation for me. I went to sleep and didn't do anything about it. Next morning, I woke up and my lungs were like somebody had rubbed sandpaper. And I got out, I told you, immediately got out and made myself this drink. And it just came out of my head, all these things. Thankfully, I had all those things in my arsenal at home. And that drink went around all of Walla Walla, got known as the bomb. But I will tell you, I put lots of garlic in it, and mine at first probably didn't have as much honey in it, but people, have adjusted things, and if they didn't like so much garlic, I told them, don't put so much garlic in it. It's got enough of the other stuff like we already talked about, all right? And within 5 minutes of drinking that, my lungs felt much, much better. And so I told you about my friend who got COVID pneumonia. I went to take care of her, taught her family how to help her, put her on this drink, had her steam, had them do fomentations, had them do the warming socks. She was much better in a few days, and she kept getting better. She said, Sherry, my family's had to go back to work, and it wasn't the weekend, and it was summertime, thankfully. I said, go take a sun bath. That sun bath will be like a hot fomentation to you. Go out and turn over both sides, then take a cool shower and go in and go to bed. All right? So you can use a sun bath in place of a hot fomentation if you need to. Just don't forget the cold at the end. What happens? Why do we always insist, with the cold? Remember, I mentioned it the other day. Do you remember? What does, after hot, what does cold do for you? It increases your white blood count. Sun bath would be more for late spring, summer, early fall. But I will tell you that they used to wrap tuberculosis patients up in Colorado mountains, put them in winter clothes, put them out in their chairs under blankets, and have them sit there and enjoy the weather all day, and it helped improve their tuberculosis. Brought them in, fed them, they took the water out to them, food and stuff, but they were out there for several hours, as long, they were watching over them during that time. So, and that was getting out in the fresh air and sunshine, but of course it was dead of winter, so it wasn't warm. But bundle up, even if you get a little sunshine on your face, you will get some vitamin D. But again, we were talking about the 45th parallel. Yeah, anything lower that, you get more equator. Well, up here, you're getting the arc. You just have to be cognizant of the fact that in this zone, we need perhaps to supplement vitamin Ds. And if you do that, be sure you get your vitamin K2 with it. Vitamin K is good, but vitamin K2 is different. And from what I understand, somehow we have to supplement that, and I'll have to do more research about it. But you need to have the vitamin K2 so that the D and all those vitamins will disperse to the proper areas of the body, which you want that calcium stuff to go back to the bone, not to the lining of your arteries. So if you bought vitamin D not knowing it, you can buy the bulk K2 and just combine the two while you're, because I had to learn that later too. Be sure and read labels, and it's becoming more a big deal now. I know that I have helped my sister with migraines, and massage has helped her greatly to de-stress, to get the muscles that are in the body loosened up. But also, dairy products is one that they say stay away from dairy products. If you have migraines, that's something I really needed. You learn about all these things, but dairy products are very hard in our society, very hard to kind of go around because everybody puts cheese on it. Cheese is just not the best food for us. It just isn't. And do you know that they did an experiment with spiders? Spiders, they tried to give them some caffeine and they could not weave their web, right? They could not weave their web. The other thing about caffeine you may not know, but it will weaken your willpower. It will weaken your own willpower. And in this time, I don't know if there's anybody that doesn't believe in the Lord here, but in this time and age, we need all the willpower to stand for God that we can. All right? So that's one thing. Remember that caffeine, whether it's in coffee, tea, chocolate, caffeinated pops, soda pops, is a drug.
Yeah.
We do our best to stay away from drugs, right? Do your best to stay away. Find something else. Herb teas are great. Some chocolates that are not dairy-based, some of them are supposed to be good for you, and I I cannot verify that. Okay, I have not studied it because I just haven't had the time. And if you can, get used to start getting used to growing your own garden and preparing your food from scratch. Okay, but that's just, in this busy world, McDonald's just isn't the place to go. Castor oil is something I've heard good things about. I mean to be using it. I have not used it yet. I have it I just haven't gotten it out yet, and I need to do that. I got thrown off a horse and broke a rib. Anyway, I have this big fatty tumor right here, and I'm thinking that castor oil might be so I'm going to be trying it, and I'll let you know next time. But anyway, yes, and more about migraines. If you increase your greens, I have read that it will overcome your migraines. And if you want Dr. Max Gerson out there, his books are there. He came up with this diet system. Look up Max Gerson. He did that for his own headaches. Later on, he found that it took care of people's lupus. It healed them from cancer. And that is how come he became rather famous and then got kicked out of the United States because he was overcoming cancer, lupus, migraines. Well, autoimmune disease is something that's happening to a lot of people. I did have some information. Where is it? Anyway, I have to study more about that, but I do know that I would go off of, again, start with a good, wholesome diet, a lot of greens. Take care of your gut, that's for sure. Well, I took care of this man for several years, making him green smoothies, and he had to have them made in a special way. He did not eat ripe bananas. He ate green bananas because that's supposedly the only thing that would not set his stomach off. And I just made him greens and with pineapple and then greens and a banana. He kept thanking me because before I came, nobody did that for him. And he kept thanking me that he was feeling better. And I have learned that MS and different things like that is an autoimmune disease. My granddaughter had Hashimoto's, and it's under control with her doctor. But I learned that if you can get 15 cups of greens, now 15 cups of greens a day in a blender and blend it up and get that, that will actually reverse. It's been known to reverse MS. And this was a doctor that got MS, and she did it for herself. That's quite a bit of greens for a while. But if you're looking for a cure, you can do it for a while, right? And see how that helps. It helped this doctor overcome her. She was in a wheelchair, unable to move, and it progressed to that point when she started. Have you ever heard of Nicole Napoleon? Oh, she is quite the herbalist. Look up her name. Do we have it, how to spell it? She's got books out. She's got her personal story. And she still has MS, he says, but you'd never know it and she did it through diet. Yeah, I was going to let you know, I have some of my essential oils over here. If you put a drop, now I don't dilute it, and I understand you really should, but it doesn't bother my skin. So anyway, I just put a drop on my finger, and I get behind my ear, and I draw it down this way where the station tubes are, and that has been very helpful for earaches and stuff like that. Nasal lavage, it's in your book, and steam, all right? That's the same, nasal lavage is probably the same as the neti pot, right? And just use that every day and try to get that out. You can also use the lavender here, right? If you need to drip it, to put half and half with some grape seed oil or something, you can do that to dilute it if it's too strong for you.